Hello friends, in this video we are going to learn very easily the classification of the anti-anginal drugs. So let's get started. But before directly going into the classification of learning the anti-anginal drugs, we must know what is the use of these anti-anginal drugs. These drugs are useful to prevent, abort and terminate the chest pain which is caused during coronary heart diseases. The cardiac muscles in our body, if it doesn't get enough blood supply and oxygen supply due to any blockage in the arteries of the cardiac muscles, then that condition is known as coronary heart disease. And the chest pain which is associated with this coronary heart disease is known as angina pectoris. So you have to understand here that we are going to prescribe the drugs, we are going to learn the drugs which are useful in eliminating the chest pain or angina pectoris which is caused during coronary heart diseases. The anti-anginal drugs are classified under 4 subclasses. An easy mnemonic for remembering all the 4 subclasses comes as follows. Many of us know a famous Hindi television program, right? That Kaun Banega Crorepati show. If you know that show, then you will also know the classification of anti-anginal drugs because Kaun Banega Crorepati comes at night. Here K for Kaun, also K for K plus ions, potassium or potassium channel openers, and B for Banega, B for beta blockers, C for Crorepati and C for calcium channel blockers, and N for night and also N for nitrates or anti-anginals. Example of drug of potassium channel opener is nicorandil. For beta blockers you will have propranolol, adenolol. Now the third subclass, that is calcium channel blockers. Under this calcium channel blockers we will have 3 more subclass. An easy mnemonic has been made for easy remembering of the subclasses of the calcium channel blocker, that is, actually while watching the Crorepati show, Kaun Banega Crorepati show, we will have BP down, BP fall, am I right? So that is blood pressure down. Okay, the mnemonic for knowing the subclass of calcium channel blocker is blood pressure down. Here B for blood pressure, B for benzodiazepines, P for phenylalkylamines, and D for down, that is dihydropyridines. Okay, example of drug of benzodiazepines, that is diltiazem, and for phenylalkylamines we will have verapamil. For dihydropyridines we have amlodipine, felodipine. Then the last subclass of anti-anginal drug, that is nitrates or anti-anginals. Under this 4th subclass there are 4 more subclasses, that is similar to the 3rd subclass which had 3 more subclasses. The same way 4th subclass has 4 more subclasses. There is no mnemonic is needed to learn the 4th subclass 4 subclasses, because it is very easy. Let's see what is this. Short acting, intermediate acting, long acting, very long acting. Under short acting we will have amyl nitrite. Example for intermediate acting, that is GTN, glyceryl trinitrate. For long acting we will have isorbide mononitrate and isorbide dinitrate. And for the very long acting drugs or the longest acting drugs we will have pentaerythritol tetranitrate. Okay, fine, the topic has come to an end. Now we will have a quick recap of the contents till what we have studied in this video. We had discussed the use of anti-anginal drugs using various diagrams, and then we saw the classification of the anti-anginal drugs using a mnemonic Kaun Banega Crorepati comes at night. Then after knowing all the subclasses we have seen all their respective drugs on the each subclasses, and for remembering the subclasses of calcium channel blockers we used a mnemonic blood pressure down for easy remembering of the subclasses of calcium channel blockers. And for nitrates it's very easy to remember because it's simply short, intermediate, long and the longest acting. Thank you for watching this video till here, and if you want me to do any further topics in any other subjects, just mention in the comment section. I will do it for sure, and stay tuned for my upcoming video, and have a great day.